Stand up, fight back! What do we do with home care under attack? Stand up, fight back!
The big ugly bill is going to put Virginia in a pickle.
3 rural clinics in Virginia are shutting down because of deep Medicaid funding cuts tied to the One Big Beautiful Bill Act. So Augusta Health confirmed closures at its Buena Vista Primary Care Clinic, Churchville Primary Care Clinic, and Wyers Cave Urgent Care Clinic. These aren't small losses. Each site serves as a frontline access point for families in these rural communities. So the reason is financial strain. This big, beautiful bill is projected to pull nearly $26 billion out of Virginia's healthcare system over the next 14 years, and rural areas will feel it first.
We're already seeing hospitals close in Southern Virginia. The people in Southern Virginia that need healthcare will still go to a hospital. They just have to travel farther. And that means longer lines, longer wait times for hospitals in Northern Virginia. It may not be your local hospital that closes, but if a hospital anywhere in your entire region closes, that affects you because all those people will start going to your hospital and making wait times even longer for your care.
Listen, according to Augusta Hospital News, there are 3 hospitals in rural Virginia that will be closing. They will consolidate, and they are reporting it is because of the One Big Beautiful Bill. Y'all know that's the bill that Donald Trump was pushing so hard back in May, June, and July. He wanted it passed by the 4th of July, but it didn't happen then. But eventually they went on and passed it. Big, Beautiful Bill Act, right? So that cut millions and millions and billions of dollars from Medicaid. And they are saying that because of these Medicaid cuts, these hospitals will not be able to sustain. I told y'all that. I try to tell y'all that. Go back and listen to the video. Go back and look at the videos. I told y'all that Medicaid was very important. The dollars that go out there keep a lot of these rural hospitals open. And if they cut those dollars, I said, guess what? Hospitals will close.
It isn't often that right-wing accounts surprise me, but this one made me sick. So recently, the Augusta Medical Group announced that it was closing 3 rural health clinics, and it's left that community reeling, people wondering about how they're going to get care. It's a whole mess. And the reason that they're closing those clinics is because of Trump's One Big Beautiful Bill that Republicans have supported, that's taking away lots of money from Medicaid. It's going to raise insurance premiums for the Affordable Care Act insurance. And so it's left people scrambling, and this is happening all over the country. But there are right-wing accounts here in Virginia saying that the reason that those clinics are closing is because they had something to do with trans kids. And it just shows like the depravity of this logic, that they want to scapegoat this vulnerable population of people while rich people are getting tax breaks and lining their pockets because we're taking away health care from working class people. And so let's just be really clear. Let's draw a line under it. Rural healthcare clinics are closing because of Trump, because he's taking away the money that supports those clinics.
What these policy changes could mean for the stability and survival of hospitals.
President Donald Trump's signage of the Big Beautiful Bill has some feeling all but pretty.
At full implementation, our projection is that these programmatic changes will cost hospitals in Virginia in excess of $2 billion annually.
That's because while there may be an influx of citizens without insurance, hospitals will still have to provide care without getting paid. That's what Julian Walker says is just the start of the uncertainty.
I can't imagine any organization in healthcare or otherwise that could lose 1/5 or 1/3 of their annual net revenues and continue to function the same way they functioned before taking that financial hit.
Multiple rural healthcare clinics in Virginia are having to shut down because of Donald Trump's Big Beautiful Bill. And the worst part is the Republican elected officials in Virginia are absolutely silent about this. Augusta Medical Group said it's closing 2 primary care clinics as well as an urgent care center as an ongoing response to the One Big Beautiful Bill Act and the resulting realities for the healthcare delivery. Jenna Chrysler is a Democratic candidate running for House of Delegates in a district that includes a large amount of Augusta County. She also also works as a physician, and one of these clinics that are closing is only 5 miles from her house. Here's what she had to say. If you have the closing of those 3 clinics, you will have an increased demand on the remaining clinics, which are all at least 10 miles away or slightly more, which is 15 to 20 minutes of a country road. Of course, this major increase in the time these people are going to have to take to get to a hospital could result in them passing away. But I guarantee Donald Trump and all of the billionaires who are getting a massive tax cut don't care about that.
Hello guys, and welcome to the Joe Report, where we get an outsider's view with an insider's clarity. Rural Virginia is freaking out, and for good reason. In communities where access to healthcare is already limited, the closure of 3 key clinics has left thousands of people uncertain about where to turn for help. Augusta Health has confirmed that it's shutting down the Buena Vista Primary Care Clinic, the Churchville Primary Care Clinic, and the Wires Cave Urgent Care Clinic. For the people who rely on these facilities, this isn't just inconvenience, it's a crisis. These clinics are the first stop for everything from children's checkups to emergency care for the elderly. Now, their doors are closing for good, and the people they served are being left behind. Before we proceed, all credit goes to the creators of these videos. You'll find their ads in my description box. But for now, let's watch a few more clips, and I'll be back with more commentary.
Big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
Here's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance because if you're not working, you're going to lose your health insurance, and then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident, and for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day, you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that, for you, for her. Now, thank God that she had successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all.
The reason Augusta Health says is simple but devastating. Money. These closures stem directly from deep Medicaid funding cuts tied to the One Big Beautiful Bill Act, a piece of legislation that promised to streamline government healthcare spending but is instead stripping rural areas of critical lifelines. Analysts estimate that this bill will put nearly $26 billion out of Virginia's healthcare system over the next 14 years. That's not an abstract figure. That's the difference between open clinics and shuttered ones, between staffed hospitals and boarded up buildings. And according to experts, up to a quarter of rural hospitals across Virginia could face similar fates if the funding shortfalls continue. For the people who live in these small towns, the reality is already setting in. Families who used to have a clinic just minutes away now face long drives for even basic medical care. The closures are turning what was once errands into exhausting journeys. Behind these statistics are real people. Imagine a nurse in Churchville who's worked in the same clinic for 20 years, now packing up her things and saying goodbye to patients who feel like family. Or think about a single mom in Buena Vista who has to choose between taking a day off work to drive her child to another town for care or risking their health by waiting it out. For them, this isn't a policy debate. It's a daily struggle, and it's the direct consequence of decisions made hundreds of miles away in Washington, D.C. The One Big Beautiful Bill Act, heavily championed by conservatives and celebrated by DT as a revolutionary step for American healthcare, is proving to be anything but beautiful for the people it affects most. The bill's architects claim it will cut waste and restore balance to federal spending, but what it actually did was cut deep into Medicaid and Medicare, programs that serve as the backbone of rural healthcare. These aren't bloated bureaucracies. They're the funding sources that keep local clinics running, pay nurses' salaries, and provide access to care for families who don't have private insurance. The tragic irony here is that the communities now suffering are often the same ones that believed in DT's promises to fix the system. But even more striking is that Virginia voted blue in the last election. Kamala Harris carried that state, and voters there largely rejected DT's policies. Yet even in a state that tried to move forward, his legacy continues to shape outcomes. The policy frameworks being established during this administration are draining healthcare systems and putting rural lives at risk. So now, even those who didn't vote for him, who hoped for something better, are paying the price. What's happening in Virginia is a painful reminder that federal policies don't just exist on paper. They have real-world consequences that ripple through towns, families, and lives. When politicians in Washington talk about cutting costs, they are not the ones who have to drive 2 hours for an urgent care visit. They're not the ones trying to manage diabetes without regular checkups or hoping they don't get sick because there's nowhere left nearby to go. Those burdens fall on ordinary people, the ones who don't have a voice in the legislative room but feel every decision that comes out of it. Nurses who've spent decades serving their communities are suddenly out of work. Patients are being referred to facilities that are already overburdened and underfunded. And the worst part, everyone knows this is just the beginning. Once a rural clinic closes, it rarely reopens. The staff moves away. The equipment is sold off. The building sits empty. And with each closure, the fabric of the community unravels a little more. Critics of the One Big Beautiful Bill Act have long warned that this would happen. The so-called efficiency reforms would devastate small healthcare systems. They've pointed out that when you gut funding in the name of cutting costs, the people who suffer most are the ones who can least afford it. But supporters of the bill continue to defend it as fiscally responsible, ignoring the growing crisis on the ground. It's a familiar story. Numbers and talking points take priority over people's lives. Meanwhile, healthcare workers are being stretched past their limits. Doctors who once handled manageable caseloads are now serving multiple towns. Emergency rooms are seeing spikes in patients who should have been treated in clinics that no longer exist. And the people at the top, the policy makers who made these cuts, seem nowhere to be found. For residents, the frustration is boiling over. They're not just angry, they're scared. They see what's happening and they feel powerless to stop it. The damage is already done. The healthcare infrastructure that took years to build is collapsing faster than anyone imagined. Rural Virginia healthcare system is now at a tipping point. What's happening in Augusta County could soon spread statewide and beyond. It's a cautionary tale for the entire country, showing what happens when healthcare becomes a political game instead of a public service. Policies passed under the banner of efficiency and reform are now dismantling the very foundations of care. And while politicians argue over budget ceilings, it's the nurses, parents, and elderly citizens who are paying the ultimate cost. At the end of the day, this isn't just about policy, it's about people. Families are suffering because of decisions they had no control over. Entire communities are losing access to care because of cuts made in the name of ideology. And the most painful part is that it didn't have to be this way. The system wasn't perfect, but it was working for those who needed it most, until it wasn't. So what do you all think? How many more clinics have to close before Washington realizes that healthcare cuts don't save money, they cost lives? Let me know your thoughts down in the comment section. I would love to keep this discussion going. Otherwise, that's it from me. I also have another video specifically tailored for you. And if you enjoy such kind of content, please click up here and enjoy. Also, consider subscribing, liking and sharing because it helps me grow my channel and helps YouTube recommend this video to a wider audience. Lastly, I would implore you to join my channel and I would really appreciate it. But for now, thank you so much for watching. And until the next time, the Joy Report out.